Background on myself. Oh, I got the recording thing. Sorry, pause. um, a little bit of background. So I've been in the Department of Psychiatry since 1995. By training, I'm a marriage and family therapist. For the first 20 years or so, I know I'm old here, but for the first 20 years or so, my work really focused on creating on adolescent substance use research. And in that research, we would create like brief interventions for kiddos who were experiencing substance use in a niche that wasn't really addressed in a lot of societies. So we have quite a lot of prevention programs for kids who aren't using, and Minnesota has quite a few options for folks who are using at a more severe level on the SUD spectrum, but there wasn't a lot in this middle ground of kids who are doing a little bit more than experimenting, but yet not quite having a lot of consequences. So a lot of my work focused on this niche. It's still something I'm very passionate about because I still see it as something very much missing in this continuum of use. But in that work and developing these brief intervention approaches, what ended up happening is we really saw the impact of the family. And so in the didactic that we had done back in November, that was a piece that I brought up, is this bidirectional sense of adolescent substance use, because we've really learned that adolescent substance use is such a family illness, such a family disease. The youth might developmentally withdraw, hang out in their room, pick fights kind of thing, in many ways very developmentally appropriate, but at the same time that leads to parental anger or frustration, which then we have this dance back and forth, and the kids get ticked off, and that leads to them lashing out, and we have this back and forth bidirectionality of the family dynamics in that. The other piece that I didn't say much about, I don't think, in November, is just really looking at the cost benefit analysis of focusing on the family for pediatric chronic illness. Putting adolescent substance use in that group of chronic illness for adolescents, or pediatric, I guess it would be. But and actually I was just pulling up, I'm going to pull it up here quick right before, because I couldn't remember the numbers. If we look at some of the research on it, this study that was done, I don't know, I'll look at, gosh, it was back in 2016, so not too long ago, but really looked at this family program for pediatric chronic illness, and that included a lot of different illnesses, from diabetes to substance use to cancer to those kinds of things. But what they found was that for every dollar spent in the family program, that third-party payers saved approximately $574. And so, medical expenses were reduced by 86% when family was involved versus just focusing on the kiddos. And so I think, not only from a patient care perspective is where my mind goes right away, but I even think about this broader with all the political stuff going on in Minnesota and all of that. I think about this broader of the cost benefit analysis that it affects for a family. Anyway, with that being said, I just wanted to use today to kind of continue that conversation in true kind of ECHO fashion, and using that ECHO core belief of all teach and all learn. And I have case presentations that I can bring up as examples, but I guess I really wanted to start by just highlighting some of the common family dynamics, or common family dilemmas, I should say, that I see in working with families dealing with adolescent substance use. And then have just a group didactic from the various lenses and all the expertise we have here, to see how the multiple disciplines we have in this room can really approach these topics, so we can all kind of learn from each other in that way. And so a little bit of a different, approach, but I'm looking forward to actually seeing how others do it. So I have a couple of, like I said, common family dilemmas, but please bring up other ones that you guys see, because obviously there's a whole slew of them that we can get into. But I think one of the first things that I guess I wanted to bring up and see how other people deal with is how do we help parents learn to trust the process? I think, and I'll be curious how you guys see this too, but I think a big part of, or a big obstacle that I run into is parents understandably wanting that control of, nope, they need to do this, this, and this. And I heard that this is the best and we need to do this, this, and this. So I'm curious, I just want to open it up. And how do you guys help parents kind of relinquish that control a little bit and start to learn how to trust that process?
Okay, I have to just chime in a little bit to say I get very conflicted about this because being a parent myself, it's really hard to relinquish control. So it's part of this empathy that I certainly feel that I if it were my child, and I've certainly been in situations with my children where it's really hard to relinquish control. So I think first of all is to acknowledge that this is not easy. There's not one bit of this where trusting in the process feels easy. But I have to, then if I put on my clinician hat for a minute, one of the things that I have found to be the most helpful, and I'm so glad we actually have two of them here today, have to be those family peer specialists, because there's nothing that I can say, I think, that means as much as somebody who has lived it and can say, I get it, you know, I've been where you are. So in my experience, it's having that person who's actually done this and been there and gone through it, I think to me is one of the most helpful. But I have to say, it's really hard. I have to watch myself. I get very conflicted because I've been in that situation as a parent myself.
Yeah. And actually, Piper, I think that's the beauty of it, to have both that professional and personal view. And I too, when I was going through the research, my oldest two were teenagers at the time, and just that I'm going through some of the same stuff, and just that conflict as well of, oh man, and but yet having to put on that professional hat. Yeah, it does get to be very difficult. So yes, that empathy piece and that connection, what I heard in that is like talking to people who maybe have gone through it, but just who get it, I think for me, like who really gets it. So I agree totally. What are some other perspectives?
I often, oh, I'm sorry, Nancy, you want to go?
No, it's okay. Go ahead. I'll follow up.
Very brief, but something that I do very regularly is invite the parents that I'm talking to step back and recall what they remember of their childhoods and of their transition from childhood to adulthood, especially. And sometimes I take a slightly different approach depending kind of what approximate generation the family is that I'm talking to. So like how I talk to boomers is a little bit different than how I talk to Gen X and so on and so forth. But I ask families to remember, the benefit of age is that we have experienced youth, and it's really easy to forget what it was like to be a young person when you were a parent and you're terrified for the well-being of your kid. So I try and walk them back a few steps and build empathy for the plight of their children as they're struggling to become fully realized versions of their adult selves.
Can I ask you, Orly, what is one of your biggest kind of differences the way you approach it if it's an older parent, like you said, a boomer, versus a younger parent, maybe a Gen Xer? What is the biggest, this is me being completely curious here about, like, what do you say differently or approach differently?
People who are parented by the silent generation typically have different experiences as children than people who are parented by boomers. So boomers are kind of oftentimes reacting to their childhood being parented by silent generation being a little bit more permissive, right? And boomers who were parented by the silent generation tend to have been raised in rather draconian black and white sorts of structures in their childhood. So I don't make the blanket assumption. I just sort of elicit, I say, let me tell you about how the people from this particular generation in my family interacted with me when I was a kid. Does that sound familiar to you? And sort of verify if I'm on the right track. And then, it is something that's a little bit different if the parents were raised with extremely rigid parenting style versus if they were raised with maybe more permissive, borderline being ignored at times in your childhood parenting style. right? And there's a lot of variation. So I can't make assumptions, but I try and figure out what their childhood experiences were, and then talk about how their childhood experience does or does not match how they're parenting their kid, and what they remember from what they experienced, and what they want to do and how they want to show up with their kid going through various challenges. So it's kind of like motivational interviewing for family style. I don't know. Yeah. So that's one thing I do.
Thank you, Orly. I think that's, yeah, I have several thoughts that I want to jump on, but I wanted to go to Nancy because I think Nancy is going to jump in.
Oh, thanks, Andrea. So just a couple of thoughts bubble up for me right away. And I don't know, Nathan, if this has been your experience as well, but this topic of control and parental fear, or the dual topic, I should say, is a family peer in my role, probably one of the number one things that parents want to talk about. And parents always want, it seems like, a concrete answer. Where's my boundary? What should I do? What should I not do? Right. And so I think, and of course we can't, I can't answer that question, but I think just sharing kind of my own personal story with them, as a family peer does to some degree, and then sitting in the moment and just acknowledging the emotional complexity of what they're experiencing. And I have two sons in their early 30s. My older son lives with schizophrenia and has since the age of 15, fairly disabled by his illness, living in a group home. My younger son lives with addiction and has been, chemically free for several years now, but there was about a 4-year period where I didn't know whether he was going to live or die. And so having walked down both those roads, I think it's helpful to just, again, sit with parents in those emotions. The other thing, because we can't answer those questions directly for them, given family system, just the complexity of the whole situation in general, I touch on individual therapy for parents and just encourage them to do some of their own therapy, because there's so much emotion to process. And where are the boundaries when it comes to codependent, maladaptive behavior as a parent? And so just encouraging them to take a step back and try to get as emotionally healthy as they can be, so that when they find themselves in these emerging situations, they feel grounded and rooted in what, their personal boundaries are, thinking about building their own resilience, so that when they're partnering with their children, whatever their age is, at least they can know to some degree that they're doing it from a healthy, strong, solid perspective. So.
Love that. I mean, I think it make a lot of really valid points. And if I could even just add, in addition to the individual therapy, I've had several parents really benefit quite a bit from group therapy and NAMI, parenting programs, that kind of thing. So, obviously there's only so much time we all have to do therapy 5 days a week, because it's tough for families, but when they can, introduce that group therapy as well. I about that totally. Orly, I wanted to jump back to what you were saying when you said that you kind of walk back a few steps and kind of recognize where those parents are coming at. And I thought what came up for me with that I thought was, an important aspect that I bring up in a lot of my own work as well, is kind of this generational learning, which essentially becomes a culture of the family, right? And so helping the family explore that, because I think what happens, and I think what you were referring to, is when we look at like the societal stuff of parents who were maybe raised in the 80s and 90s, at that point, if you look at the data kind of thing, you'll see that cannabis use back in the 90s was really regarded as not a cool thing at all. Or at least, nationwide, they may have different pockets, but for the most part in society, weed was looked at, oh, you were a druggie if you smoked weed. It's very different now. And so a lot of that, bringing up where the parents are coming from, helps them to kind of wrap their head around the societal perspective on substance use and how the kids are kind of dealing, the teens today are dealing with something a little bit differently than maybe they did when they were, when the parents were growing up. So that the societal and generational impact definitely is part of it and can help parents kind of broaden that perspective. And again, slow down, maybe not completely trust the process, but slow down and start to see it in a different light. What are some other ideas of helping parents trust the process? Does anyone else have thoughts on this topic and how others deal with it or address it?
I hope my audio is better
A
now.
little bit,
Oh my gosh. I can put my comment in the chat.
but, oh, okay. So we'll wait for Melissa's. All right, well, anyone else have thoughts too while Melissa's typing? We have such a wealth of experience in the room that I know others are working with families and have ideas of how you dealt with it.
Andrea, just to add one more note, when it comes to trusting the process. One of the things that I stress too with parents is just open lines of communication. And when their child does open up to them and feels like they can talk about what's happening, whether it's with their mental health, chemical use, whatever it is, to just be very intentional about listening and not judging.
Love that.
Yeah.
For sure. And as you said that, it reminded me the first time someone told me to, trust the process, quite honestly, my response is, WTF, what does that mean? Come on. I'm the parent, I've got to, this is my job, this is my role. And so helping parents, explore what that means to trust the process and being present in the moment, because so often as our anxiety takes us into the future. And what if this happens? What if this happens? I need to control this now. And so really trusting that process, helping them understand is staying present and kind of exactly what you're saying, Nancy. How do we open those lines of communication? We open our hearts and our minds to what's happening now, to what their experience is, so we can stay present and not jump ahead to that, anticipatory anxiety, which is what we're grasping for in that control, right?
There are 2 comments in the chat, Andrea.
Perfect. Thank you. Okay.
So
Oh, yep. Okay. So actually, Nathan comment, have you ever had difficulty differentiating between FEP and cannabis use? And I think Nancy kind of addressed that one, right? The FEP and cannabis use. Can there be difficulty differentiating? Absolutely. And a lot of times there's overlap yeah, and in fact, the case study that I, brought up, or that I have today, if we need an example to go through, touches on that for sure. Yeah, and I think that's, for me anyway, that's where I really kind of rely on the team approach of like, let's get different eyes on this. How do these different lenses look at it? Kind of like what we're doing today, for sure. And Melissa, this speaks to Minnesota especially, but I think there's going to be a shift in societal perspective since our legislation, is most likely moving forward with legalization of recreational use. People will have much easier access, which can be scary for families. Absolutely. And I have to say, Melissa, that again, I'm old. So when Colorado first legalized it, and in California back in, 2011, I think, or 2009, somewhere around there, like over 10 years ago now, it was such a big deal. And I could totally see a shift in working with the families of the teens saying, well, it's legal here, or it's legal. And the parents are like, no, not in Minnesota. But the whole argument of legality in the adolescent brain is nothing. They'll use it for their benefit, but screw it if it's against them, kind of thing. So it is, I think you have a very good point that the whole societal perception will change, but with parents as well. Because I think we can even see that. I see that even, you know, with my own cohort of people who are like, well, yeah, we can have THC gummies now. It's not a big deal anymore. Where back in the 80s, 90s, no, that would be, you know, much more taboo kind of thing. So no, I think you make a really good point with that.
Andrea, I'm just going to point out there was a second comment from Nathan in there about a parent. Did you see that?
Oh, yep. And I passed right over it. Thank you for pointing that out. Parent, I recently began an eviction process because their 20-year-old son is routinely confronted by dealers. Yes, absolutely. And this brings up, yeah, actually kind of a related kind of topic too that I had bringing up of the impact on the parents and kind of creating their own boundaries. And so, yeah, impact on the parent of losing your housing, huge. And it also brings up what happens when the kiddo turns 18, because legally, I mean, so there's a lot of different pieces in this, Nathan, that I think, you know, is great. Let's see, I was going to ask if you can say more about it, but you're in that communal space, so sorry. Yeah, it is a difficult piece, and that is part of, I think, helping parents recognize, helping families recognize the kid too. And I think if the kid can be in the room, you know, as well, and be part of this process, I think it can be a real beneficial conversation, because I think, I'm trying to find my words here, sorry. Looking at boundaries, the word codependence comes up and in my mind, and actually, quite honestly, I hate that word, but I think if we look at it from a, I don't know, from a, you know, a substance use treatment type of approach of how when we try to help our kids, sometimes that help turns around and becomes too much, and then it pushes those boundaries to the point of being evicted and that kind of thing. So helping the parent and the youth together, trying to find better boundaries for both to stay healthy and have a roof over their head as much as we can. It's hard to say more on that, but what do others say on that? I mean, that's just my very vague response, but how would others kind of address this?
One of the things that I found helpful, and it's some training that we got in the department, and if anybody hasn't gotten it yet, I would highly recommend it. I found it to be very, very helpful. But we did crucial conversations training, and one of the things that I found helpful, especially around families, because I get this when IRT clinicians come to my consultation calls, and they'll say things around, you know, this family or this young person is having trouble with the family. They're not sure if they want to include the family. What if they go back and it just doesn't work out, and these kinds of things. And one of the things I found helpful is starting from what's the goal here, right? The goal here is we want you to be happy and healthy. We obviously, in this situation, we want mom and dad to keep their housing, we want the child to keep their housing. You know, what's the goal here? So how do we come back to not all of the emotion part of this, but really get on the same page? Like, we actually probably all want the same thing here. Is there a way that we can come to have a conversation about this that helps everybody maybe get on the same page, so that it's less around kind of those different emotions that come up and more around the boundaries? And I found that to be helpful.
Yeah, good point. Thank you for bringing that up. That was a good training, that crucial conversations. Other thoughts, or does anyone else have other topics as well? I have more topics, but I want to open it up to if other people have kind of family dilemmas or dilemmas in helping a youth with substance use disorder involving their family stuff.
Just to continue a little bit with the boundaries, because this is something that definitely comes up.
Yeah.
all the time when I'm
Yeah.
talking with families. And obviously none of us can tell people what their correct and appropriate boundary is and when and exactly where to place
Yeah.
it. So I oftentimes, I guess, just do really simple perspective taking. Like I share with family, hey, I'm a person who talks to a lot of different families who have some similarities to what you have going on, but also
Yeah.
some differences. And I
Yeah.
can tell you that boundaries in this sort of situation can look like everything from really hard rules and tick, 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 three strikes and you're out, to extremely permissive. And there's very, variable outcomes for all of these, and what works and what doesn't work is entirely dependent on the individuals, on your family culture, etc. So I just kind of set up the expectation that nobody else can set that boundary for them. That's like internal family work that we can talk about and I can be a sounding board for.
Yeah.
But yeah, perspective taking that there isn't a right answer.
For sure. And I like too with that of defining what some of those boundaries might be and how boundaries are variable. They can change. The boundary in one area doesn't have to be the same boundary in another. And I often use the analogy in boundary conversations of sometimes our boundaries kind of like what you say, rigid, they're a brick wall. Nope, there's a no-go. Sometimes those boundaries are a screen door. Sometimes they're a doggy door. I don't know. But helping the parents kind of create that visual metaphor to start kind of grasping, okay, is this a brick wall for me type of boundary? Or,
yeah, I also like
can
to
this be
tell
more
families that you're allowed to change over the course of your lifetime, that even grown-ups learn and grow, include like not just their young adult children, but them, the parents.
Oh,
and
for sure.
grandparents and everybody else. And sometimes people have
Yeah.
that shocked face, like,
Yeah,
we can
Well,
change our expectations and then communicate those changes.
I think especially having the youth in the room and the youth hearing that, recognizing, because sometimes I think there's a part of this individuation process, which is so natural for this age group developmentally, is seeing our parents as human, right? They're not just mom, they're not just dad, they're not just the person who pisses me off. And likewise, parents starting to see the kids as capable and not holding them to, their history of, whatever, not doing their homework when they're in 8th grade or whatever that might be. So making room for that growth, I think, is what I'm hearing you say, Orly. And I think that's so appropriate and so important for all of them to hear as part of that individuation process. Most definitely. Jules had a couple comments here. Great point, Jules, where she said, I have focused on parents' emotional safety and then needs to be well in relation to their young adult living with them. Absolutely. As well as physical safety, but less so. If the person's been violent or bringing others to the home, they don't know or trust, they can't thrive either.
Yeah.
Setting house values and boundaries together. Yep, absolutely. Much more eloquently said than I did. So thank you, Jules.
I have one family that I
Yeah.
am continuing to work with. I don't have many that I'm still working with right now, but one family that I've been working with for about a year, who's actually touched in the Navigate program and now in the Strengths program, but has had like a really terrible like cocaine addiction on top of just regular marijuana use. He sees the narcotics and the cocaine as being the addiction and a problem.
Sure.
So he wants to use marijuana.
Yeah.
But there is a time that like he was bringing home people that parents had never met and like some really sketchy characters into the house,
Yeah.
and like is dating this girl who
Yep.
they don't even know where they met. And we sat and talked with like, at what point do you decide like that's not safe for you to have these people
Exactly.
in your house? And if like we got to talk with this, and the individual themselves never comes to our family sessions and will not ever come to our family sessions.
Yep.
Really having that conversation with them of like, how do we, like, let's set the line together and let's talk about how do we hold that line, or what's
Yeah.
flexible within this, because
Yeah.
there's going to be some things that maybe you find flexible, like, okay, you come home high. Is that safe? Is that not safe? Are you okay with that in your house?
Yep.
Okay, you're high and you bring a stranger. Is that safe in your house? Is that not
Sure.
safe? And figuring out how many times that boundary being crossed is the line. what
Yep.
and what do we say and what's next. And they've, after, over a year of working together, they have said,
Yep.
you're out, I'm bringing you to detox. Like, you
Yep.
can't be in my house, I'm bringing you to detox. We'll talk
Absolutely.
about housing after that. And they've never ever been like a hard stop of you can't ever come back. It's
Yes.
your safety, your addiction, and in
Yep.
your mental health is in such a poor place that we can't be safe. So you're going to
Yeah.
be here. Once you start working on these things, then we can
Yep.
talk about when you can come back.
Yep, absolutely. And I really like that you brought up not only the boundaries, but how do we hold that line? And I interpret that as like, okay, inevitably that boundary is going to be pushed, right? Because that's human nature. We're going to push that boundary. So how do we hold that line? How do we, have the follow through piece of it? And I think that's such an important part of the conversation to have, because it's one thing for us to say, a boundary in my house is you're, never gonna, use cocaine. Of course they're going to push it. And what are you going to do about it? So let's have that conversation and get them thinking about that. And I think that's a really important piece of this whole thing too. Thank you for bringing that up.
Has anyone ever used kind of role plays to help with that boundary setting, to help people find the words, to help them like just get some muscle memory? I'm curious if anybody's done that before and what recommendations they would have.
I do that quite frequently with families, but I want to hear others first. I talk too much. I want to hear what other people have.
I'll say reluctantly, I don't really like doing role plays. I've always been uncomfortable with them, but I have people talk about their elevator speeches, and I have them bring out notebooks and to kind of write down what they wish they would be able to say, and to kind of practice with themselves in a mirror and give that as home practice. So I'm happy to hear what you guys do too for role plays and how you make it more comfortable in these situations.
Okay, I'll jump in I'll jump in because it sounds like a lot of people or maybe don't do it. I don't know. And I can't say I do it all the time by any means. I think that again, when our emotional state can be so high, and we're so concerned about our kid, concerned about ourselves, losing, being evicted, and quite frankly, in many cases, angry and very frustrated with the whole situation. We can't find the words. And so coaching the parents through, using I statements. And I think oftentimes it's one thing to say, here's using I statements, or, and looking at those family dynamics, it's one thing to just say it, but then to actually practice it in session. So I will have them practice it. Even if it's just asking, how might you say this in your house? What's going to feel natural? Because obviously if you're reading off a script, that's going to feel very inauthentic, and the son or daughter is not going to really respond to that if it feels that inauthentic. So let's talk about what feels like a natural thing. What do you want to say? Kind of going back to what you were saying, Jules, of what is the message you want to send? And then let's practice that. If I'm the young person here, this is how I might handle it. Was this how your child would handle it? Or maybe you be your child, and I can respond in what way? What would that look like? So it's not like a prescriptive type of thing, but it's more to get them thinking of like, how might these dynamics go? It kind of shows that dance of, yeah, you say that, but that's not at all what sounds natural. And so that would be like, whatever, you're just reading from a book. And so getting them to just kind of think about how do I do it, and the power of words. I'm one who really takes quite a narrative approach, and the power of words has become so clear to me in my years of working of, helping parents say when they do this role play, when they utilize certain words that can really be demeaning to the kids or put up that wall of defensiveness. And so kind of coaching through that, and helping them see how, when you say this, what do you think your kid hears? Because communication isn't just about us saying something. It isn't just about us talking, it's how does the other person interpret it? And you know your kid really well. So let's think about this. So that's another aspect of why I like, maybe not specifically role play, but modified role play, I'll say.
I do role play with like from the individual's perspective to the parents a lot. And I think that can be an interesting dynamic too, because sometimes the individual or their adolescents don't really know how the parent's going to respond. And so me playing out like the different extremes can be like a fun, if it's an adolescent, it can be a fun way to like just like see those different dynamics and like then think of responses which super different extremes, as well as like it'll probably be somewhere in the middle. So how can you have that conversation then? So
Love that idea. So giving, again, perspective taking, right? And it could go different ways. So let's, yeah, cope ahead and think about how would you cope with any of these and deal with that. Perfect. Nancy, you talk about utilizing the LEAP method of communication. Can you speak more about that?
Sure. So listen, empathize, agree, and partner. It's been my experience that staying as calm as possible as a parent when having those conversations is really important, and really listening. One of the things that I have experienced with my younger son and noticed was the degree of shame that people who are addicted to some substances can experience. So when there's anger, parental anger, when there's any kind of disrespectful behavior, uncontrolled behavior, things get said, all it does is make things 100% worse. And so really empathizing with the fact that this is truly an illness. I went through the family program at Hazelden twice with a group of parents whose children were all addicted to opioids, as was my son. And they did a couple of really powerful exercises to help build empathy and help us to be able to relate to how the addiction was affecting all of us in the family. One of those was to have the person living with addiction and parents to make separate wellness wheels, right? So you've got the spoke of financial impact, physical impact, emotional impact, all those different areas of life. Fill those out and then come together and look at how the addiction is affecting each person's total wellness in the family. And it was really eye-opening for all of us and helped me as a parent to really empathize with the degree to which this drug had become the air that my son breathed to survive. So building that empathy piece, recognizing the illness, and then also just encouraging parents not to make really severe idle threats that they're not willing to follow through on, right? So kind of getting back to that boundary issue of, how are you going to set up a structure within the family with boundaries so that it's very, very clear and concrete to everyone involved that if these certain behaviors happen, this is what the consequence is going to be. But immediately going to the bottom right-hand corner of the page and saying, if you smoke one more joint, I'm kicking you out of the house, likely isn't going to be very effective. But parents react out of fear. And
of course,
I've learned all this the hard way.
Yeah. Absolutely. Yeah.
So,
because again, parents are human too, and we have our own feelings, about this too. And so that's that beautiful dance that this comes down to. And it's such a difficult dance. And as professionals in trying to navigate that, because then we have all the different family pieces that come into that too. So very great points, Nancy. Thank you for bringing that up. And that wellness wheel, I agree, that's such a powerful approach in a family therapy setting to do that. So yeah.
Andrea, could you explain the wellness wheel just for those of us who don't have that context?
Sure. It's kind of what Nancy was saying. I guess I don't usually put it in a wheel form, but getting parents and the teen or young adults to start to think about more how is a substance impacting various parts of your life. And now I'm trying to think of, I haven't used it in a while. So thinking there's relationally, how is it impacting us? Financially, how is it impacting? I do like a future oriented, like goals, I guess, area. What other areas I've used?
Work and
Family,
school.
financial. Oh yeah. I guess, yeah, I kind of put that in the future one, work and school. Now what else is in there, Nancy? Like, I'm trying to think. I want to say I usually do 5 or 6.
Social
Oh,
interactions.
social, yes, thank you. Peer social, yeah, that one too. How is it affecting that area? And I think that one, I'm glad you brought that one up, because I think that's one that is, I have found to be pretty powerful when the youth hear the parents talk about how it affects the parent socially, and how they might be, embarrassed or have a hard time talking with their own friends when they say, oh, how's the kids doing? How are the kids? How do I respond to that? Or when other parents are talking about, oh, my kids, doing this wonderful, wonderful thing and graduating college, and they're like, it's like a punch in the gut of, that's not where my kid is. And so it's hard for it can be very eye-opening anyway for the kids to hear that part of it too. And it goes both ways. And like you said, that empathy, compassion can be, it's hard, and it's very therapeutic, I think, in this whole process of getting them moving in a different direction. Were you going to add something, Nancy?
The other exercise that we did as it related specifically to opioids was the therapist had us do kind of a visioning exercise where we were to picture a box in the corner of the room, and inside the box, that was locked, by the way, was a gauge that measured the oxygen in the room. And so we had to go through this process of imagining that there was this gauge, right? And we were watching the oxygen level in the room drop. And the only way we could get more oxygen into the room was to get the box open, but the box was locked. What would you do to get that box open? Because that's what it felt like for a lot of our kids with their use, right? And so, and they did this slowly. I mean, they did this, this was like a 10-15 minute exercise of doing this visualization of watching the oxygen meter in the room drop. So by the time we were at the end of this thing, we were all like, oh my goodness, I'm really stressed out by this.
Yeah.
And yeah, so again, another empathy building exercise, and just really helped to explain a lot of behaviors. And
Sure. Interesting. I hadn't seen that exercise before. That's a cool one that opens the eyes of what that experience is like for the kids. Cool.
Yeah, it was pretty intense. Yeah.
Okay. Going back to kind of family obstacles or family dilemmas that you guys run into that would be helpful to address in this, all teach, all learn approach. What are other kind of frustrations or struggles that you guys have in working with your populations? Anything?
I think we've talked about it before, but as a person who works with family, and sometimes the young person is present, and a little bit more often they're not. When we have an awareness of substance use from the young person, and family is not aware, but shares various struggles that may be being influenced by substance use. Boy, I hate being in that position.
Okay, so kind of the almost secret keeping, I think I'm hearing you say, or okay.
Yeah, it ends up feeling like that.
Yep.
Absolutely.
To me,
I should say.
Sure. Okay.
And I think that that's unique in our program, because we have families meeting with family clinicians and individuals meeting with individual clinicians, and then we meet as a team and discuss updates.
Sure.
And yes, the patient's aware that we're a team-based care and we're, consulting and updating, but like you know, and it goes the other way too. Like I hear things as an individual therapist from the family clinician about like dynamics in the family that the individual hasn't even told me about. And then I'm going into session and it's a dance of like how to communicate that, stay transparent, when is it appropriate not to, you know, it's with substance use too. It's really, it feels icky, honestly.
It does. Yeah. Yeah, most
Yeah.
definitely.
I have to be really, at times, thoughtful about how I'm documenting things. And I pretty
Yes.
frequently bring up to family in these sorts of situations, hey, family, remember, you're not actually my client. Your child's actually my client, and everything we talk about in some fashion is going to be documented in your child's medical record.
Yeah. Yeah. And it is hard, even with that statement, because I'm thinking about that too. Then are we setting the parents up to hide, to lie, to, you know, because well, I don't want that my kid's record, so I'm not going to say that, or, you know, so that's the hard piece too, where that might be a critical piece of the treatment plan, right? So it is such you know, yeah, a difficult dance to experience and to navigate in that way. And then obviously we're talking, you know, in a fairly vague form because these secrets could be a variety of things, but how have others kind of addressed the secret keeping piece, if we call it that? I'm using that as a very yeah.
I think it's very hard. I'll just say, I think it's really hard. And I think that there's no one right way to do this, honestly, because I think that there's often context that informs what decision you make. I tend to, you know, if you're coming from the family perspective, right? If you're in a family session, I think it's different for family sessions versus individual sessions. But if you're in a family sessions, talk about what would it mean if you actually shared this with your loved one? What would that look like, right? You know, and going back to what's your purpose here? What is it that you're trying to accomplish by telling me this? Why now? What does, you know, this coming out? Because oftentimes it's more than just the secret. It's what's behind kind of driving that secret. And sometimes that's actually much more workable as a problem than the actual secret is. And talking about like coming from that perspective. And I think it's different when you're in, and I certainly have seen it that perspective more when you're in the individual session and they're talking about some things in the family and coming up. I just consulted on a case the other day where they were talking about the mom is telling the kid things and the kid wants different things. But as an individual clinician, which we often get stuck in the middle, is that it's unhealthy for some of the boundaries that mom is setting with, or not setting, I should not setting with the kid, but to put a kid in a position to go against their family, their parents, that's just never going to turn out really in a good place, in my experience. So it goes both ways, but coming to how can we come together so that we're all on the same page kind of thing? What's the purpose here? What do you want from your family? What does the family want for their kid? Is that a place to start, to at least, so it's less about the secret and more about what do we really want to accomplish here? That's what I've found to be helpful.
Yeah, I do like that because it takes it out from the specific, what they're viewing as a specific secret, and let's bring it out a little bit further. And when we can bring it out a little bit further, we get to what is really underneath that, what you're saying, and why is this so daunting? What's behind the secret? And we can get to that bigger issue for sure. And I think I'm not sure if you said this exactly, Piper, but I think, you know, in a family session, I'll often try to break it up and have individual sessions too. I'm not in the same program as you guys, so maybe you guys have different parameters around what you can do, but talking with them individually and getting them to think about whether it's the parent with a secret or the youth with a secret, either way, getting them to think about, okay, what does this mean to you? What are the potential outcomes of talking about this versus not talking about this? And let's, let's get into that. And how can I help facilitate that if you do think it is important to tell them? So yeah, and to your point as well, Piper, that it is very contextual. It's not a checkbox of do X, Y, Z, and then it's going to be fine. So yeah, easier said than done, most definitely. But Orly, I see your note. Family purpose is often framed to me as I'm telling you so you guys can address it, but don't tell them how you found out about it. Yeah, yeah, I love it. So address this in secret. Yeah, a great conversation. How have you handled it, Orly? I'm curious for you.
Yeah, that's oftentimes what has actually led me to, I'm a bit hyperbolic when I say to you guys, family, you're not my client. This goes into their medical record, but I explain to people how that is actually not how we can operate. We cannot take action on things that we would have no way of being aware of without explaining how we got the context.
Yeah.
Right. And
sure.
Then I ask them if there is something that I can do to help facilitate. Like I will offer, like, hey, can we have young person come join us?
Yeah, absolutely.
You want to do that? Then the family will break one of two ways. They'll say, okay, never mind.
Sure. Yeah.
And I'll still at the very least explain to the rest of the team what information I got and, do sort of vague documentation, family shared concerns related to financial, blah, blah, whatever it is.
Yep. Okay. Totally. And I think an important aspect that I really want to point out, you didn't say this, but what I'm hearing in what you're saying is I think you're modeling boundaries for the parents as well. This is how I create boundaries with that. And so that word may not be attached to it for them, but I think that's a great way of modeling of this is where I need to hold this boundary as far as this doesn't really work. So how are we going to do this differently? That's much more collaborative. So yeah, I think that's such a huge part of, again, that therapeutic process and trusting that process in that way for sure. Okay.
In my role, I actually do a lot of managing of expectations and reinforcing boundaries of what the scope of my work is and is not.
Yeah. And that's something, that I like to point out to parents whenever I can, because again, that word boundary can mean different things for different people and it can be fairly effusive, but when we can point it out like, this is a boundary, this is what this looks like. I wonder, how do you translate this into that, the home, it's life too, and Melissa added, or they'll call the nurse and say, we just want to pass along this message. So same kind of thing. Okay, pass along the message. So I know, and I think the other aspect that I would add into this topic of secret keeping is checking ourselves with our own anxiety about this too, of like, okay, they pass along this message. Do I need to address this now? Because we can sometimes feel that urgency depending on whatever that message is. And so how do we check ourselves and say, okay, can I just breathe through this for a second and think about, is this a critical thing for the well-being of the youth and the family? Is this, something that we can take baby steps and then really kind of use that backdoor approach and eventually address this issue organically, in a few sessions as we do baby steps to say, hi, I wonder about XYZ. This commonly happens with people. I wonder if this has happened to you. And then it kind of organically comes up without ratting out the person who called or person who brought it up. So yeah, it is. So, kind of checking ourselves and our own emotion and timeline with that too would just be one other aspect I would add to that.
And I would say we have two things that you can use and navigate that help with that. One of them, Andrea just mentioned, and I would think of that as the fact that at working as a team, you're not in it alone. You can go to the IRT clinician if they're family clinician, or as a family or an IRT clinician, you can go to the family clinician and say, this is what came up. We talked about this. Here's where we landed on this. I want you to be aware of it. If you can bring it up organically, I think this could be really helpful, right? There's doesn't have to be pressure or urgency, but this idea that you're not in this alone, that you can problem solve together. Sometimes that actually results in a joint session together where the person may not be willing to meet with their family, with the family clinician, but if the IRT and the family clinician meet together in a session, that can also be helpful. So I would say that's one place where we tried to give you backup support there. The second one, I think, is this problem solving model that both of you have access to. It's an IRT in the action plan and dealing with negative feelings, and it's in the family manual as well. And one of the tools you can say is, if you're not willing to share this with the loved one, the problem isn't going away, right? You're modeling for them, what do you do? The problem doesn't go away. You've still got the consequences of what's going on with the behavior or the belief or whatever it is. So using your problem solving model and kind of going through, if this isn't reasonable, if that doesn't make sense to you, if you're not comfortable with that, what are you comfortable with? And using that model to help you think through. I will do this with individuals. I will recommend this in consultation is pull out that sheet and let's just go through it together. And talk about, like, if you're not willing to do this, what are you willing to do? Because clearly there's something that's driving you, that this is a problem. So I'll just point out those two.
Are you talking about the action plan worksheet?
Yes, I am.
Okay.
Yep.
Awesome. Love that. Thank you, Piper, for bringing up those resources and reminding of that, for sure. Anything else on secret keeping? Or we've got about 15 minutes or so left, so we can bring up another common obstacle if anyone has one, or of course, like I said, I have some as well.
I was just thinking, and I don't know how common it is, but I'm working with first episode psychosis, like substance use has a different impact on the the people that are dealing with psychosis than it does for people that don't deal with psychosis. Like the risks are higher in terms of overall wellness and stability and recovery. And I think sometimes that's hard for I'm not sure about families because I don't really work directly with the families, but I think it's hard for the client to recognize, and I do a lot of work with people and just educating about that, but I'm just wondering if that's also comes up in families, is their understanding about how much even just a little bit of substance use can have such a high risk.
Sure. Yeah. How have you managed that? Because where my mind goes with that is, again, the role of fear, bringing it to the family, that education, while I'm fully a believer in we need to have this education and understand this, there can also be that fear and anticipatory anxiety that encourages the parents to just kind of hold on even tighter, this, oh man, you have the psychosis kind of stuff, you can't even smoke a cigarette or something like that, which then the kids are going to push back, because we also have this very normal individuation process and very developmentally appropriate that we also have to balance in all of this. So how have you managed it so far, and how have others managed that? That interaction between psychosis and substance use?
I mean, when I'm working with the individual, it's like, this is the information that I have and that we know, and it's really just presenting that and asking it then about how has it, in your experience, how does this fit with what what you've experienced, and it's I just want you to be aware of this, and we'll and especially thinking when people are having ongoing substance use and having concerns about symptoms or having increase in symptoms, it's pretty obviously correlated with use. It's a lot of motivational interviewing, honestly, about it.
Which I think motivational interviewing is such an important approach approach to utilize in this situation, with this age group, actually, especially with this. Okay, and I'm seeing Nathan, and one of my IRT therapists here doesn't want to know certain information. I've learned from family members. I see. Yeah. Oh, okay. So that's kind of going back to that secret keeping for Nathan Clay. Sorry, I wanted to jump in on that, Krista, because I thought that was related to what you were saying. So yeah, the psychoeducation piece. And with the families, I mean, I think psychoeducation is an important piece. And there's also that, for me, what I would also do is dive into what does that mean for them emotionally, because so much of this from the family perspective comes down to that emotional, the emotional consequences of all of this. And there's going to be fear, there's going to be disappointment, there's going to be shame, embarrassment. There's going to be a lot of those. And so starting to pull those pieces out, especially when you have this interaction of psychosis and substance use. And that can happen with other, things too. I have one of the cases I was going to present today was a youth who has diabetes and had some psychosis and the substance use as well. And it was all mixed up because when he would use, his blood sugar would drop to dangerous levels, and then he would have psychosis type symptoms. And so, kind of, it was a very messy, confusing, is this psychosis? Is this, a result of blood sugar drop? Is this a result of the drugs you're using? And so there was so much confusion and everything. So yeah, that interaction is hard, and we can't pretend that we know exactly what's going to happen, but we need to have those conversations. Thoughts from other people, this interaction between psychosis and substance use, and kind of balancing those concerns.
I think it's hard for parents, especially in like school stuff, or like adolescents, to determine what is negative symptoms of psychosis versus what is due to substance use.
Yeah.
Like achieving goals in school or working or things like that. And so I think, ultimately the goals is kind of the same, but I think it's hard for sometimes them to be like, well, this is psychosis versus substance use.
Yeah, absolutely. And sometimes I challenge families to think about, does it matter? Okay, and if it does, let's talk about, why does that matter, of if it's a psychosis versus a substance use, because I think that's where some of the shame can come from then. The shame can come from as well. So yeah, getting them to think about, why is that important to them?
I think it comes back to like the controlling then too. So if it's substance use, then they feel like they have more control over whether their adolescent is using or not.
Yep. Bingo.
Versus
yeah,
psychosis. So
for sure. And that's such an important piece to really point out, because the other thing too is that also goes to that whole idea of substance use as a mental health disorder. And it falls into, especially when the substance use is in that middle ground of the continuum, that niche of, not quite a problem enough, but more so a problem than just trying it once or twice. So, and so I would run into that quite often, because it's hard to see, is this a behavioral issue? Is this, I would argue, a family issue, but I recognize my bias in that. But is this, or is this, the start of a severe mental health disorder of, chronic substance use? And so it's a difficult, it's a muddy area, I guess, to navigate. And so, I totally lost my train of thought where I was going with that. Oh, but yeah, just to kind of help them see that control. If they believe it's behavioral, then they feel they have control. Where if they feel that it's more of a illness, well, it's out of my hands kind of thing. And so helping them kind of navigate their views on substance use and that origin is an important aspect of it too. Thanks. Sorry, I had that brain. But anyway, other thoughts on this and recognizing the substance use and psychosis interaction? Okay. Just a couple of the other common dilemmas that I had written down just to kind of get you guys thinking. I don't think we have time to jump into it, but I think they're important aspects that, kind of more food for thought. One of the bigger ones that I see, not bigger ones, one that I see fairly regularly is refusal of treatment or therapy, either by youth or parents. Sometimes the youth saying, I don't need it, weed isn't a big deal, or I'm fine, you don't know what you're talking about, I'm not going to therapy, I'm not going to involve in this. Or even parents. I've had some parents of saying, nope, I don't believe in therapy, we're going to just do medication approach, that kind of thing. So looking at, how do we address it when parents or youth refuse any kind of treatment? Another one that can come up too is what happens when they turn 18. And this kind of came up, I think, in Nathan's piece of the 20-year-old. And I think from a family, working with families, sometimes, I see a level of relief from parents. They're 18, this is on them, I can back off, my responsibility is done, kind of thing. But then there's also fear, because now, it's going to hit the fan a little bit more too. They have more serious consequences. And so there's a lot of, different aspects that come up with that. So, yeah, those were a couple of the other dilemmas I was going to bring up. Any last thoughts in our last few minutes? Or Piper, is there anything that we need to do in the last few minutes? I don't want to.
No, I mean, I think that this was so really interesting. I so value everybody's perspective. It's so nice to see, people speaking up from these different perspectives and getting good ideas. I think none of this is easy. I'm thankful every day that I work on a team for team-based care. It does make a difference. You're not the lone practitioner on their own. So I value each and every one of you so much, and I appreciate your feedback. And Andria, this was a great discussion. These are hard issues, and I think that we all value just being able to take a different perspective. So I appreciate the facilitated discussion. Is there anything else that folks would like to bring up for today? Okay. The last thing I'll say is that Carissa and I are trying to plan out the remainder of the last 6 months we have of this contract. I don't know what's going to happen afterwards. But if there's a topic that you are really would like to see an expert present on, if you have a case and you haven't reached out to Carissa, please do so. We are looking for more ideas around the substance use topics in particular. We continue, Chris and I meet every week, and we will continue to brainstorm and rack our brains to come up with some good ideas that we hear you talking about. But if there's another presenter, if there's another topic that we can do a little digging and try to get somebody to present on, we have about 5.5 months left of presenters. So let us know. And thank you everyone for coming. Happy New Year.
All right.
Thanks,
Take care, everyone.
guys.
Yep.
See you in a couple weeks.
Yep. Bye-bye.
Bye. Thanks, Andria.
You bet. See ya.